Have you ever looked down and wondered if the shape of your penis is normal? Have you ever noticed a curve and asked yourself, is it supposed to be straight? Is something wrong with me? Maybe you have even felt a wave of anxiety or embarrassment because of a curvature that seems to be there. That is exactly what we are going to talk about today. This is a topic that causes a lot of silence, a lot of hidden frustration, and a lot of unnecessary worry for men. It is very common for men to feel distressed because their anatomy doesn't look like a perfect geometric ruler. They worry that their penis isn't perfectly straight and that this deviation implies a medical problem or a sexual failure. In this discussion, we are going to break down exactly when a curvature should be a cause for concern and when you can completely relax and stop worrying. Because there is a very big difference between a natural variation and a medical condition that needs treatment. First, we need to establish a baseline of reality. It is statistically very common for a penis to have a curvature. It might curve slightly to the left, to the right, or have a mild upward or downward slope. This type of curvature is widely seen in the general population. The most important rule you need to understand right now is this: if that curve does not impact your sexual life, if it does not prevent penetration, and if it is not causing you physical pain, it is not a medical problem. It is simply your anatomy. You should not lose sleep over a curve that functions perfectly well. However, it is important to manage expectations here. For these natural, functional curves, there isn't a non-invasive treatment. There isn't a pill you can take to straighten it out. If it works, the medical consensus is usually to leave it alone. But if you are experiencing issues or if something has changed, that is where we need to dig deeper. This leads us to the most critical question you need to ask yourself to determine if you need a doctor. That question is, has it always been this way? You need to look back at your history. Have you always had this curvature since you started having erections, or is this something new? This distinction changes everything. If your answer is no, this is new. My penis used to be straight, and now it is curving, then we are likely looking at a condition called Peyronie's disease. This is an acquired condition. It is not something you were born with, it is something that developed. How do you spot it? Usually, it starts with a curvature appearing out of nowhere. You might notice the penis beginning to bend. A very common sign in the early stages is pain. You might feel pain when you are erect or even when flaccid. When you touch the shaft of the penis, you might feel a hardened lump, a nodule, or an area that feels like scar tissue under the skin. This is Peyronie's disease. It is a condition caused by fibrosis, essentially internal scarring, in the tunica albuginea, which is the elastic sheath that surrounds the erectile chambers. When that scar tissue forms, it loses its elasticity. So, when you get an erection, the healthy tissue expands, but the scarred tissue doesn't, causing the penis to bend toward the scar. This can cause significant emotional distress and practical problems in a man's life. If this sounds like what you are experiencing, it is crucial to communicate with a medical professional, specifically a specialist who dedicates their practice to men's sexual health. You want to catch this early. The goal of treating Peyronie's in the active phase is often to prevent progression. We want to stop the curvature from getting worse. We have conservative treatments available for this. We use specific anti-inflammatory medications, and we utilize mechanical therapies. This can include the use of a vacuum pump or penile traction therapy. Using a penile extender can help mechanically stretch the tissue and guide the healing process to minimize the curve. However, in some cases, Peyronie's disease can be more aggressive. It might evolve despite conservative measures, or the curvature might settle at a degree that makes sex difficult or impossible. In those cases, we may need to look at surgical solutions. Surgery for Peyronie's is tailored to the patient. For some, it is strictly about correcting the curvature, straightening the shaft so intercourse is possible again. But in more complex cases, where there are severe deformities, significant shortening, or if the patient also suffers from erectile dysfunction that doesn't respond to medication, we might combine procedures. We correct the curvature and implant a penile prosthesis at the same time to restore both form and function. So, to summarize this first category, if the curve appeared out of nowhere, especially if you are over 50, though it can happen to younger men too, it is likely Peyronie's, and you should seek help to manage it. And while we are talking about managing your sexual health, we have to be honest. Often, the worry isn't just about the curve, but about the firmness and reliability of the erection itself. If you have been feeling like your performance isn't what it used to be, or you just want to wake up with that youthful, rock-hard vitality again without relying on dangerous pills, you need to see this. I discovered a presentation about a bizarrely simple, 7-second daily habit, a purple hardening tonic that is helping thousands of men naturally reverse these issues and stiffen their erections by targeting the root cause. I've put a QR code right here on the screen. Go ahead and point your phone's camera at it to watch the short video explaining exactly how this natural remedy works. I have also pinned the link for you in the top comment below. It's a total game changer for your confidence. Now, getting back to our list, let's look at the second scenario. The other answer to the question, has it always been this way, might be yes. This is what we call congenital curvature. This is a curve that has been present since puberty. From the moment you started experiencing erections, you noticed a bend. This is not caused by an injury or a disease process. It is simply how your body developed. Most often, this presents as a ventral curvature, meaning the penis curves downward. This happens because of a disproportion in growth. The corpora cavernosa, the two large chambers that fill with blood, grow longer than the corpus spongiosum, or the urethra on the underside. It creates a bowstring effect, pulling the penis down. Just like with the natural side-to-side curves, we have to look at functionality. I see many patients with congenital curvature who have a completely satisfactory sex life. They have a curve, but they can penetrate, they don't have pain, and their partners are comfortable. If that is the case, nothing needs to be done. You are healthy. However, if the curvature is severe, it becomes a mechanical barrier. We are usually talking about curves greater than 30 degrees, and certainly those over 45 degrees. At this angle, penetration becomes difficult or slips out easily, and it can be painful for the partner. It can also cause distress for the man, knowing that the mechanics of sex are compromised. In these cases, the treatment is almost exclusively surgical. We don't use traction or pills for congenital curves because it is a structural issue, not an inflammatory one. The surgery typically involves a corporoplasty or application technique. Essentially, the surgeon places permanent sutures on the longer side of the penis to shorten it slightly and match the length of the shorter side, effectively straightening the shaft. An interesting note about congenital curvature is that these patients often have a longer penile length to begin with. Because the penis is curved, it creates an illusion of being shorter. The correct way to measure a penis like this is with a flexible tape measure, following the curve along the top from the base to the tip, rather than using a rigid ruler which would cut across the empty space. By rectifying the penis surgically, we are making it functional, even if the technique technically involves shortening the long side to straighten it out. So, whether it is a condition you were born with or one that developed later in life, the solution depends entirely on the impact it has on your quality of life. The takeaway here is simple but powerful. If your penis has always been a little curved, it doesn't hurt and it works, relax. Learn to love your body as it is. It is functioning exactly as it should. But if the curve is new, painful, or so severe that it prevents intimacy, do not suffer in silence. There are effective treatments, from therapies to surgeries, that can restore your sexual health. Now, I want to hear from you. Have you noticed a curvature that worries you? Was this information helpful in distinguishing between a normal variation and a medical issue? Please leave your thoughts in the comments below. If you want to dive deeper into men's health topics, make sure you are subscribed to the channel. And finally, if you know someone who might be quietly worrying about this, share this video with them. It might be exactly the reassurance or the guidance they need.